Hello friends, today we will discuss the genetic generalized epilepsy syndromes. First syndrome is childhood absence epilepsy and the typical age of onset it is 4 to 10 years. Remember absent epilepsy is of two types, childhood and the juvenile. In the childhood we have the age of onset is 4 to 10 years and the seizures are basically typical absences. Rarely it can be generalized tonic-clonic seizures and the treatment we have two options, ethosuximide or valproic acid. Now, what is the prognosis? If a child has childhood absence epilepsy, majority will have spontaneous remission, usually before or during the adolescence. Minority will convert into JME or other syndrome. So this childhood absence will convert into JME or other syndrome. And in EG, we have a normal background. There is a generalized spike wave fragments. Typical, what is a signature mark? It is a 3 hours generalized spike wave during the absences. And if you do the brain imaging, it is normal. And it has a complex inheritance. But the GLUT1 deficiency, that is glucose transporter type 1 deficiency, should be considered if onset is below the age of 4 years. Second important syndrome is the JME, that is juvenile myoclonic epilepsy. Age of onset is 12 to 18 years. Typical type of seizures, these are myoclonic or GTCS, but absences are less common. Valproic acid is a first line. In the females, we don't use valproate, we use other drugs like levetiracetam, but avoid carbamazepine and oxcarbazepine. Majority are controlled on medication, but a small and minority they are able to wean off. Means if a patient is diagnosed with JME, only minority of the patients they are able to wean off from the treatment. There is normal background, intricate generalized spike wave, polyspikes, wave fragments, high amplitude spike wave polyspike burst with myoclonic seizures, and imaging is normal. Complex inheritance, but GABRA1 is rare autosomal dominant cause. Third syndrome is juvenile absent epilepsy. The typical age of onset is 12 to 18 years. Typical absences are there and generalized tonic-clonic. Many options of treatment are there. Prognosis is less than half and a half are seizure free on medication. They usually require lifelong treatment. So childhood absence they show spontaneous remission, but at JE they need lifelong treatment. Normal background, integral generalized spike wave and polyspike wave fragments, 4 to 5 hours generalized spike wave during absences. Brain imaging is normal. There is complex inheritance in vast majority. Epilepsy with generalized tonic-clonic seizures alone. The age of onset is any age between 5 to 40 years. Mainly there is generalized tonic-clonic seizures and treatment options are variable. Patients with mild childhood onset they have a better prognosis. Normal background with intellectual generalized discharges. Imaging if done it is normal. It has complex inheritance. So patient will have only generalized tonic-clonic seizures, no history of absences, myoclonus. Epilepsy with eyelid myoclonia. Age of onset is 1 to 16 years. Eyelid myoclonia, absences, generalized tonic-clonic. Treatment is there are many options. Drug resistance is seen in 80% of cases. And normal background, there is 3 to 6 hour generalized spike wave, spike wave. But important thing to remember that there is fixation of sensitivity. Imaging is normal. There is complex inheritance and vast maturity, but some genes like CHD2, SYNGAP1, casein, they can produce similar phenotype. They have more severe intellectual disability. So these are the important genetic generalized syndromes. Thank you.